Good morning, everyone. Good morning, good morning. Graduates, as Lana Del Rey would say, it's you, it's all for you. Congratulations. For those of you who don't know me, my name is Perry Halkitis. I am the very proud Dean of the Rutgers School of Public Health. On behalf of the faculty and staff, I welcome all of you to our convocation to celebrate the accomplishments and achievements of the class of 2024. This university celebration is taking place to celebrate the culmination of students' hard work and earned degrees. It is a momentous event for all of our graduates and their guests, their family, their friends. So let's respect that and enjoy this afternoon and morning together as we celebrate our accomplishments. Please remain standing for the national anthem and lift every voice.
Oh, say, can you see by the dawn's early light what so proudly we held at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming. And the rugged the bombs bursting in air gave proof through the night that our flag was still there. Oh, say, does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
Please stay standing, yeah. Please stay standing for Lift Every Voice.
Lift every voice and sing till earth and heaven ring with the harmonies of liberty. Let our rejoicing rise high as the listening skies. Let it resound loud as the rolling sea. Sing a song full of the faith that the dark past has taught us. Sing a song full of the hope God of our wearies, God of our silent tears, thou who has brought us far on the way, thou who has by thy might led us into the light. Keep us forever in thy path, we pray.
Please be seated. Good morning, everyone. Before we begin, I'd like to welcome Dr. Rafael Perez Figueroa, Associate Dean for Community Engagement and Public Health Service, to read the Rutgers University Land Acknowledgement. Dr. Perez Figueroa.
Thank you, Dean Halkiris. Rutgers University School of Public Health is committed to the history, present reality, and future possibilities between indigenous people, this school, the land, and the environment. We acknowledge that the land in which we stand today is the ancestral territory of the Lenape people. We pay respect to the indigenous people throughout the Lenape diaspora, present, past, and future. And we honor those that have been historically and systematically disenfranchised. We also acknowledge that Rutgers University, like New Jersey and the United States as a nation, was founded upon the exclusion and erasure of indigenous people. And while acknowledging this, we invite you to commit to work in the pursuit of equity and justice.
All right, we're getting started here. Welcome. Bienvenue. Welcome. Who knows what that reference is from? Okay, well, I'll tell you at the end of the ceremony today, so keep that in your mind. Chancellor Strom, Board of Governors, members, honored guests, families, and friends, welcome to our celebration. Graduates, I hope you will take this time to reflect on what you have achieved in reaching this point in your lives, and the significance this accomplishment holds for your family, friends, teachers, and for us as a school. So for a moment, let's show our appreciation to our family and friends, graduates. This is my 7th graduation. Over the 7 last years, we have worked with intelligence and with gusto to grow our school in prominence and stature. More than anything else, we have also grown the relevance of our school as we collectively work to enhance the health of the people of New Jersey, the country, and the world. And all of this has resulted in a high level of recognition. We live in an increasingly complex society where we must prioritize kindness and humanity. Geopolitical and geobiological forces are shifting the world landscape. As society changes, so too must higher education. Schools of public health, which strive to protect our health, must also adapt and modernize to address the ever-changing conditions that challenge our individual and collective health. We can't function in the ways schools worked in the 1970s and 80s. Those types of schools are no longer relevant. I'm certain fully and with my full heart that our commitment to social justice, health equity, and inclusion, as well as our commitment to the synergies between disciplines, is preparing our graduates, you, with the skills that you will need to improve the public health moving forward. I'm also certain that to you, that we recognize that in this challenge of improving public health, we must address consistently and constantly and with gusto the political and commercial determinants of health, and this requires a new paradigm in how we do our work. This winter, after much struggle, I put the finishing touches on my upcoming book, tentatively titled People and Public Health: How Americans Created the COVID-19, HIV, and Other Modern-Day Pandemics. My career as an infectious disease epidemiologist and public health psychologist has been defined to a great extent by two pandemics. The first being HIV, which wreaked havoc upon all parts of the world, including the United States, particularly among sexual, racial, and ethnic minority populations, 6 of them my closest friends. More recently, it was the COVID-19 pandemic, which has killed 20 million people to date and left my brother, Tony, a person who lives with MS, further immobilized with COVID-19-induced retinal artery occlusion. I had no intention of writing another book. However, when I saw the mistakes of the past that we experienced during the 1980s and 90s repeat themselves again at the onset of 2020, I knew that we in public health had to change the way we think about and how we prevent infectious disease. Changing the way we think and respond is the only way to decrease the morbidity and mortality associated with pathogens that will evolve in the future. We too often overlook how the behavior of people catalyzes pathogen spread, leading to outbreaks and pandemics. What we need is a shift in the paradigm to a person-centered approach, an approach with which public health works closely with people, understands people, recognizes their cognitions and their beliefs, respects people, and works with their belief systems to leverage their emotional lives and empathy, and advantages health interventions rather than assuming human beings are rational operators who make decisions that benefit society at large. We know all too well that that is not the case. Humans are not rational operators, and so our training in public health, our training of our public health workers must equip them with the skills to understand the complexities of human beings. Putting the people at the center of intervention design necessitates such an understanding. Throughout the course of the book, I delineate how emotions, empathy, cognitions, and political leanings impact health both in positive and negative ways. In turn, I discuss how we must address the constructs in public health approaches to infections as well as chronic diseases. Addressing these challenges also requires a shift in what we teach, and how we engage with our students, you all, to develop an ethos to always keep the public in public health. And in doing so, the public health leaders of the future, you, must sit alongside clinicians, including medical professionals, during such outbreaks. This means shifting the dialogue to preventing disease rather than filling hospital beds, a conversation I recently had this last Wednesday with our new New Jersey Department of Health Commissioner, Dr. Caitlin Baston. We in public health are the ones who emphasize holistic, preventive-based approaches. Unless we prepare the next generation of public health leaders to be able to speak, understand, and work with populations that they are serving using a person-centered design, and focus again on biology, we will lose the humanity that is at the core of public health. It is with this vision that we are building our school. Yes, we have great research programs in gun violence, reproductive rights, infectious disease, pharmacoepidemiology, sustainability, and others. Yes, we have outstanding courses. Yes, we have super cool global sites. But so do many other schools and programs of public health. What makes us special is our outspokenness about social conditions that diminish health, about the importance of putting people at the center. As a school, you know this, we are outspoken on many topics that affect real people in their real lives and how politics often obscure a healthy society. In the last few years, We have witnessed legislation that allows doctors to discriminate against LGBTQ people, theocratic reproductive rights laws that take away a woman's right to control her own health, and misinformed policies that undermine vaccination of children, leading to the spread of infectious diseases. We see it all around us as rights continue to be chipped away for all of us: women, people of color, sexual and gender minorities, immigrants, the disabled. So our voices in public health are as critical as ever. You see, modern, relevant, and important schools of public health must speak out on these matters. We cannot be silent. We cannot cower. And I promise you this: as long as I remain dean, I will continue to speak out, calling out those actions which must be held accountable, regardless of the punches that I take. And trust me, I have taken many, many punches from my days as an AIDS activist to today as an activist dean. As long as I am dean of the school, I assure you that all the faculty and staff will make you proud. We will continue to build relevant educational and research programs. We will continue to be true and honest community-engaged practitioners and researchers. We will continue to call out injustice and hate and to challenge those who would silence us. You see, pathogens can make us sick, but injustice, hate, and silencing make those pathogens even more powerful. Our work in public health is as important as ever. Don't let anyone tell you anything different. And so go out into the world. Demand your place at the table. The opportunities for us in public health are limitless. This is a moment of inflection. And so be loud, be proud, be a public health scientist, practitioner, activist. Go out into the world and make change. Make a change in honor of those who you love, who society has neglected. Make a change for a better world for everyone, because it is simply the right thing to do. Congratulations, graduates. Congratulations to the class of 2024. I will look to you with great pride to move us forward. It now gives me great honor to introduce our next speaker, Chancellor Brian Strom. Dr. Strom is the inaugural Chancellor of Rutgers Health and the Executive Vice President for Health Affairs at Rutgers University. Dr. Strom's intelligence and leadership have transformed Rutgers Health, and his vision aligns perfectly with the direction of our school. Dr. Strom is a supporter and a friend of public health. He is a public health person himself, indeed. Chancellor Strom now brings greetings on behalf of the university, Dr. Brian Strom.
Thank you, Perry. And as always, I have to move the microphone down. To class of 2024, as we gather to celebrate your achievements, I'm honored to address you on behalf of the Rutgers Health community. In fact, you're the very first class to graduate with our new Rutgers Health name, brand name, a name that reflects our vision to provide innovative health education programs, as you've just heard about from your dean, and to make a lasting difference in the lives of our communities. Today, you stand at the threshold of a new chapter in your journey, one marked by immense potential and profound responsibility. As you prepare to enter the esteemed ranks of the public health profession, it is essential to reflect on the critical role that public health professionals play in addressing health equity. Health equity lies at the heart of our mission as public health leaders, scholars, and practitioners. It is the principle that every person deserves the opportunity to attain the highest level of health. Yet we recognize that systemic barriers, including socioeconomic disparities, racial injustices, and unequal access to care, continue to perpetuate health inequities in our communities. As new graduates of the Rutgers School of Public Health, you are uniquely positioned to confront these challenges head-on, and I know that here at Rutgers Health, we have prepared you to do so. Since the very beginning of your time at the School of Public Health, you've demonstrated a steadfast dedication to serve the most vulnerable among us. From your continuous volunteer work in our New Jersey community, you exemplified the values of empathy, equity, and excellence that define your profession and our missions at Rutgers Health. Together, your class dedicated over 25,000 hours of community-engaged experiential learning through the applied practice experience. Through involvement in student organizations, you regularly collected donations to the RBHS food pantry, showcasing commitment to community engagement and public health advocacy. And let's not forget our trailblazers among the class, like the first graduates of MPH programs in population aging and population mental health. Through these activities and others, you have demonstrated an unwavering dedication to the core principles of social justice and health equity, which lie at the heart of the School of Public Health mission. Your steadfast commitment to these values distinguishes you as an exceptional public health professional, poised to make a profound impact in your field. From this point on, I urge you to continue to listen to the voices of our communities, learn from their lived experiences, and strive to meet their needs with empathy and compassion. As you take your place among the ranks of Rutgers graduates, I want to express my deepest gratitude to the faculty and staff of the School of Public Health for their unwavering support and guidance. These were challenging years, not only for you as students, but also for your educators, who had to pivot quickly and continuously adjust educational activities during an unprecedented time. They have served as your mentors, your teachers, and in a few moments, your colleagues, and we're forever grateful to have them as part of our Rutgers Health family. So today, as you embark on this next chapter of your journey, I hope that you will continue to cherish the relationships you've made here with your classmates and educators as alumni of our great institution. What you do in the years to come will impact lives in the most direct and meaningful ways, and that is the greatest joy. So on behalf of Rutgers Health, congratulations, class of 2024.
Thank you, Dr. Strom. One of the first emails I received when I assumed the role of dean was from our next speaker, who I turned to for sound advice. Dr. James Doherty is the former chair of the Rutgers University Board of Trustees and a current member of the Rutgers University Board of Governors and the Rutgers School of Public Health Dean's Leadership Council. He is also involved with many organizations on campus and recently gave a $3 million gift to fund, this is weird, I always have to, when I say my name, it always feels weird to say this, but I'm going to say it anyway. The Perry N. Halkitis Endowed Chair in LGBTQ+ Public Health at the school, which will be key in launching the planned Rutgers Institute for Sexual and Gender Minority Health. So, thank you for that. Dr. Doherty is a great spokesperson for our school and someone who has become a wonderful friend. He knows how to keep me in line because he has a Greek husband too, so he knows like what Greek men are like and how complicated we can be. Dr. James Doherty brings greetings from the Board of Governors of the university.
A few years ago, whoever it was wasn't turning these pages, and I panicked when I walked up to the microphone, so I always bring a copy of what I'm going to say with me. But I didn't have to this year, so thank you, everyone. Chancellor Strom, Dean Halkitis, members of the faculty, students, family, friends, and distinguished guests, I am pleased and humbled that all of you have joined us for this celebratory morning. First, I would like to congratulate Dean Halkitis on a beautiful and successful convocation ceremony, his 7th at the helm of the Rutgers School of Public Health. In this time of ever-accelerating change and interconnectedness, Dean Halkitis' perspectives and experiences are crucial in guiding our school to provide our students with relevant, forward-thinking skills. Since Dr. Halkitis has arrived, the school has grown in size and stature. He has recruited stellar new faculty, supported the development of new areas of study at the school, such as LGBTQ+ health, population aging, mental health, and pharmacoepidemiology, and ensured that students are receiving an education and experience that is rooted in social justice and health equity in all their initiatives, both locally and globally. Plato is often quoted as saying, "Knowledge without justice ought to be called cunning rather than wisdom." And we believe, as Plato suggests, that those who learn are then obliged to act. It's an ideal that Dean Halkitis repeats often when he speaks about public health as a discipline rooted in social justice and health equity. We are a discipline that embraces the idea that a long and healthy life should not depend on where people live, how much they earn, who they love, or their ethnic background. Reality does not always live up to that expectation. Today, you are joining a community of people who are committed to promoting health and wellness. We are a community driven by research, education, and service. We hope that in your time at the Rutgers School of Public Health, you've learned not only the hard skills necessary to advance public health as a discipline, but also have come to appreciate the human elements that give our work meaning. We are a community that strives to learn about what drives both health and the lack thereof. You are about to embark on a journey where you will use your knowledge and perspectives to shape policy, promote health, and protect dignity. I can't promise you that it's always going to be easy. There are going to be trials and frustration. But never lose sight of the fact that your skills are necessary. You are needed, and you will always be needed. I believe Steve Jobs' quote from a 2005 commencement address at Stanford is also applicable to all of you. Stay hungry and stay foolish. Stay hungry is to have a want or need to have something or make something better. Stay hungry for what's right, for being your true self, and for pursuing your full potential. Stay foolish is to not be afraid to make mistakes. Don't listen to "it isn't possible" or "no one ever does that." Stay foolish, and you will have a life filled with curiosity, knowledge, and purpose. Today marks our school's 39th convocation and 41st year as a school. This past Sunday, we marked the 258th commencement for Rutgers, and I hope that many of you attended the ceremony. We couldn't be prouder of our esteemed faculty, staff, and our nearly 3,000 alumni, excuse me, whose influence reaches from our own communities in New Jersey to every inhabited continent the world over. And we couldn't be more thrilled to embrace these new graduates today. Graduates, when we leave this place today, we do so with a relationship that is forever changed. We are no longer professors and students, mentors and proteges. We are colleagues. We are united by an indelible common bond dedicated to improving the quality of health and, in turn, quality of life everywhere. We are so thrilled and honored that you chose us and that we are able to share in this celebration of your successes with you, your family, and your friends. On behalf of all the administration, faculty, and staff of Rutgers University, congratulations. Thank you.
Thank you, Dr. Doherty. The support of the Rutgers University governing boards is greatly appreciated. Thank you, thank you, thank you. I would like to now introduce our class speaker, Nikesha Gonzalez. Will Nikesha please join me on stage? Loving the hat. Nikesha is receiving, hi Nikesha. Nikesha is receiving her Master's of Public Health degree and will be providing today's address to the class of 2024. She is also the recipient of the 2024 Stanley S. Bergen Junior Medal of Excellence, which she will receive later today. Nikesha, the podium is yours.
Thank you, Dr. Halkitis. Greetings, esteemed faculty and staff, proud parents and families, distinguished guests, and my fellow Rutgers School of Public Health class of 2024 graduates. Today marks a significant milestone and another successful chapter in our lives. As we stand on the precipice of the future, adorned in our caps and gowns, I'm sure we can't help but reflect on the journey that brought us here. Each of us has a unique story, a narrative woven with passion, sacrifice, hardship, and unwavering determination. For me, my journey growing up as a first-generation Latina in a single-parent household, alongside my amazing younger brother, helped me learn the value of resilience. My mother, a beacon of strength and courage, made countless sacrifices to ensure we had all the opportunities she never had. Her sacrifices in raising 2 children, coupled with the many lessons learned along the way, instilled in me the importance of advocating for yourself and extending that same compassion to others in our pursuit of creating a better world. When I was younger, I often felt like I didn't quite fit in. While others seemed to effortlessly navigate life, I found solace behind the pages of books and in the world of Disney movies. Yet it was within these stories that I found inspiration and hope. Despite the challenges I faced, I harbored a deep-seated determination to rise above adversity and to prove to myself and my family that I could succeed. I can be the first in my family to go to college, and I can begin to break those generational cycles. Thank you. So, I embarked on a journey to carve out my path in hopes of making a meaningful impact somewhere in the world. It was here at Rutgers where I found this impact and learned the hardest and greatest of lessons. Since 2013, this institution has been my home away from home, a place where I found not only education, but community and belonging. While I didn't always have a clear path in mind, one driving force within me always remained: my passion for improving mental health outcomes, especially within historically marginalized communities. This passion led me to the public health profession and our school, which has nurtured my growth both academically and personally, shaping me into the public health advocate I am today. Throughout my MPH journey, I've been blessed with immense support, especially from my husband, Alex, whom I met at Rutgers, and who has been my rock every step of the way. His love and support have been the driving force behind my success, and for that, I am eternally grateful. I've also been fortunate to receive support from my husband's family, also my family, and my friends and classmates who have provided endless encouragement on my personal and professional journey. On behalf of the class of 2024, I also want to extend a heartfelt thank you to our dean, professors, and instructors. Your relentless dedication to imparting knowledge and expertise have been instrumental in shaping us into the professionals we are today. Your guidance and commitment to excellence have made a profound impact on not only our careers and lives, but the lives of the people and the communities the graduates in this room are going to make a difference for. I also want to give special recognition to Claire Brown, whose kindness and mentorship have been a constant source of inspiration since the very beginning of my MPH journey. Claire's commitment to the students, alumni, faculty, and staff at the school is nothing short of admirable. All of these support systems that I've been privileged to have is why I stand before you. Today, I am deeply humbled to receive the Stanley S. Bergen Jr. Medal of Excellence, a testament to the sacrifices that my family and I have made and the countless hours of hard work and dedication poured into my studies and service to our public health community. I never in my wildest dreams thought I'd be standing before everyone giving a speech and receiving this honor. This journey in public health has only reinforced my passion for mental health, culminating in my practicum capstone focused on developing wellness initiatives, which I'm extremely honored are being implemented at the school. These initiatives aim to cultivate a healthier public health workforce, addressing the crucial intersection between mental well-being and productivity, and normalizing these conversations. It reinforces the importance of mental health being important in all aspects of life, and I'm proud to have contributed and to continue contributing to this vital endeavor. However, the honor I'm receiving today is not mine alone. It represents the collective passion for public health from each and every one of us here today. With the myriad of challenges the world faces today, the road ahead may seem daunting. However, it's precisely during these times of adversity that our strength as public health professionals and as individuals shines brightest. Now more than ever, our communities need our collective resilience, intellect, and compassion. Tackling the inequities and injustices we see every day is not something we can do as a single public health professional, and we must remember to always lean on one another. Together, we do have the power to effect real change and build a healthier, more equitable future for all. As we embark on our respective public health careers, as researchers, practitioners, clinicians, educators, activists, and more, let us take a moment to be proud of how far we come and the incredible accomplishments we've achieved. From the vigorous coursework and research to the long days and nights to making a difference in our communities, everyone in this room is a testament to the power of perseverance and a reminder to all future public health leaders that no goal is too big with unyielding dedication. Let us rejoice with our loved ones, celebrating the fact that we are here together on this monumental day. And let us never lose sight of the passion that brought us here in the first place, the desire to make a difference in the lives of others. The world awaits our impact, and I have no doubt that we will rise to the occasion. So to the class of 2024, I say this: stay connected to your roots and communities, and never hide who you are and what you believe in. No matter how different your life path may seem compared to others, your unique perspectives and experiences can drive meaningful change, and above all, never waver in your commitment to public health. I'm going to end with a favorite quote of mine from one of my favorite contemporaries, Winnie the Pooh. You are braver than you believe, stronger than you seem, and smarter than you think. Congratulations, everyone. We did it. Thank you.
Who doesn't love the Pooh, right? Everyone loves the Pooh. As I said, today we will celebrate the class of 2024 and honoring graduates who have excelled in their overall scholarship while at the school. Khiara, along with others, will be honored at a special award ceremony later this afternoon. I would like now to present the Senator Frank R. Lautenberg Annual Award and Lecture in Public Health. In 2001, the Rutgers School of Public Health established the Senator Frank R. Lautenberg Annual Award and Lecture in Public Health in recognition of the leadership on public health issues that Senator Lautenberg provided in Congress. It is now my honor and privilege to announce Dr. Khiara Bridges, a law professor, anthropologist, and nationally recognized expert on the intersection of race, class, and reproductive rights, as the annual awardee. Will Dr. Bridges please join me at the podium? She has the most beautiful earrings on I've ever seen in my life. Dr. Bridges is a professor of law at UC Berkeley School of Law. She has written many articles concerning race, class, reproductive rights, and the intersection of the three. In 2011, Dr. Bridges published her first book, Reproducing Race: An Ethnography of Pregnancy as a Site of Racialization, which investigates the role of race in prenatal healthcare settings that are utilized by low-income people. Her fourth book, Expecting Inequity, Race, Class, and Reproductive Justice, which is under contract with MIT Press, explores how class-privileged pregnant people of color attempt to deploy their relative wealth and elevated social status to avoid structural racism. Recently, Dr. Bridges testified before the U.S. Senate Judiciary Committee on the legal consequences of the Supreme Court decision in Dobbs versus Jackson Women's Health, which overturned Roe v. Wade. Her testimony, which received extensive media coverage, established her as a fierce defender of the marginalized and a public health intellectual with a quick wit and a quick tongue. Her testimony encourages others to stand up for what is right and to refuse to cower to those who seek to do harm to the most vulnerable among us. Dr. Bridges, it is my honor to present you this award. I'll take that from you. And we will now ask Dr. Bridges to give us the Senator Frank R. Lautenberg Lecture in Public Health. Dr. Bridges, it's yours.
It's such an honor to be here to address the class of 2024. So I want to begin with a quote. Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. Those are the words of Dr. Martin Luther King, Jr. And on this day, this joyous day that marks the culmination of so many years of study, this festive day that marks the fulfillment of so many aspirations, this victorious day that marks the triumph over so many obstacles, I want to remind you of Dr. King's words. Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. Today marks the beginning of the next stage of your careers. Knowing that many of you will become health professionals, I say Dr. King's words to you because I want to remind you that you are entering a field that is beset with some of the most shocking and inhumane inequalities that this world has to offer. I heard that this crowd likes evidence-based things, so let me offer you some evidence, okay? My first piece of evidence, Black Americans have higher rates of hypertension and heart disease than any other racial group. Moreover, while 7% of white people have diabetes, nearly 12% of Black people and 12% of Latinx people are living with the disease. 14% of Native people bear the burdens of diabetes. My second piece of evidence, twice as many Black babies die in their first year of life as compared to white babies. Moreover, 3 to 4 times as many Black people die from a pregnancy-related cause as white people. Racial disparities in maternal mortality have persisted throughout the history of this country. Indeed, the gap has widened. 80 years ago, Black people were twice as likely as white people to die from a pregnancy-related cause. 30 years ago, Black people were 3 times as likely as white people to die. And today, Black people are close to 4 times as likely to die from a pregnancy-related cause as their white counterparts. My third piece of evidence. Suicide is an epidemic among Native people. Indeed, in 2019, suicide was the second leading cause of death for Native people between the ages of 10 and 34. That same year, suicide was the leading cause of death for Asian Pacific Islander people. I could offer tons of more evidence, but Perry told me that I only have 12 minutes today, so I'll stop there. But please note that the evidence that I've already offered refers solely to disparities within the United States. The disparities between nations, between those that are well-resourced, like the United States, versus those that are resource-poor, those disparities are a tragedy of epic proportions. For example, if you are in a wealthy country, your chance of dying during pregnancy is about 1 in 9,000. In South Sudan, it's 1 in 10. However, these comparisons between the developed world and the developing world tend to hide that there are parts of the developed world that are appropriately described as the developing world. To return to racial disparities in maternal mortality in the US, in 2014, in Chickasaw County, Mississippi, for every 100,000 live births, 595 Black people died from a pregnancy-related cause. And this statistic reveals that Black people in Chickasaw County would have had a better chance at surviving birth if they had moved to Kenya or Rwanda. Kenya and Rwanda are poor, underdeveloped nations where the maternal mortality ratio was 400 and 320 per 100,000 live births, respectively. Again, it was 595 in Chickasaw County, Mississippi. Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. And today I want to remind you of the outrageous chasm that separates the health of the haves from the health of the have-nots in this country. Many of you elected to embark on your chosen field of study because you were aware of this indefensible chasm. Many of you wanted to do something about it. After I give a talk to healthcare providers about racial disparities in health, I invariably receive the question, what can I do? I want to do something, what can I do? And I usually respond to this question by saying, what you should do is understand the causes of racial disparities in health and act accordingly. What do I mean by that? The reality is that many factors have caused the disparities that I have just described, and I'll mention just 4. First, our 2-tiered healthcare system. In this country, we proudly provide the best medicine in the world to those with the ability to pay. Meanwhile, those without the ability to pay are left trying to maintain their health on the inferior tier of our healthcare system, or they are left without healthcare at all. Second, the disparities that I described can be explained in terms of racial segregation in housing, with people of color forced to inhabit communities that feature violence, food deserts, and environmental hazards. Meanwhile, wealthier people, who are disproportionately white, can inhabit communities that are bucolic, quiet, and health-conserving. Third, the disparities that I described can be explained in terms of the harmful effects that chronic stress has on the bodies of the marginalized. Researchers are beginning to explore the possibility that chronic stress increases the speed at which body systems deteriorate, causing the health of those who endure chronic stress to suffer. The physiologic responses to persistent stress may result in the weathering of body systems, causing them to age more rapidly. Fourth, the disparities that I described can be explained in terms of the myth of biological race. The myth of biological race proposes that the races are genetically distinct. According to this idea, the racial disparities in health that are so well documented are caused by the genes that people of color are imagined to have. So if 12% of Latinx people have diabetes, biological race says, well, oh, Latinx people must have that gene that inhibits the production of insulin. If 3 to 4 times as many black people die from a pregnancy-related cause as white people, biological race says, oh, black people must have that gene that makes pregnancy deadly. If Native and Asian Pacific Islander people have higher rates of suicide than other racial groups, biological race says, oh, Native and API people must have that gene that causes severe depression, and so on and so forth. The myth of biological race contributes to racial disparities in health because it distracts us from the real reasons that people of color are sicker and die earlier than white people. If you want to get your research funded, say that you're looking for that elusive gene that predisposes people of color to death. If you don't want to get your research funded, say something about social determinants of health. Which is to say, the causes of racial disparities in health are institutional, they are structural, they are systemic. And the truth is, it is very little that one individual person can do to take down these macro, large-scale forces that have produced the health inequities that are so well documented. In reality, it's going to take a social movement to bring those down. So what can the individual do in the interim? What can you do in the interim? You can understand the causes of racial disparities in health and act accordingly. Act accordingly by joining the social movement for health when it coalesces. Act accordingly by using your expertise to incite the social movement for health. Act accordingly by refusing to participate in the lie that there is some race-specific genetic variation that is killing people of color. Act accordingly by conducting research into the biological effects of toxic social environments. And if you are a practitioner, act accordingly by being kind. Be kind to the patient who is struggling under the weight of inherited disadvantage. Be kind to the client stuck inside a vortex of forces that is much more powerful than him. Be kind to the patient who is just not taking care of herself and you don't know why. Especially be kind to her. She is likely dealing with things that will make your head spin. At times, the only thing that you may be able to do for your patients and clients as a practitioner is to offer kindness. So I want to implore you today, at the commencement of the next step in your careers, don't forget what made you go into this field in the first place. You wanted to help people. And unfortunately, because of a constellation of forces that are bigger than you and me, it will not always be possible to achieve a happy ending for the vulnerable people with whom you work. In those moments, the most powerful act of rebellion, your most revolutionary act, may be to offer kindness. Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. Thank you, class of 2024, for dedicating yourself to making MLK's words less true than they have always been. Congratulations, now go do justice.
Thank you and congratulations, Dr. Bridges. Now, remember when I said at the beginning, it's you, it's all about you. You're probably sitting there going, what's going on? These people are speaking, where am I going? Well, we've gotten to the part where it's you, it's all about you. You ready? Are you ready? All right. Oof. We have now come to the time to recognize our graduates from the class of 2024. These will include those who will be receiving the Doctor of Public Health degree and the Doctor of Philosophy degree, post-baccalaureate certificate, Master of Science degrees, and Master of Public Health degrees. Dr. Leslie Cantor, Chair of the Department of Urban Global Public Health, and Dr. Kristen Krause, Instructor in the department, will be recognizing our graduates by degree. Ms. Claire Brown, Director for Student Experiences and Alumni Affairs, will present our graduates with important information about staying connected to the school. You're going to come across the stage, you're going to take pictures, you're going to smile, it's all going to be good, right? Let's go. Let's start with the naming of the graduates.
Quick logistics. Graduates, please follow the directions of the individuals asking you to rise. And you have a choice between a handshake with the dean or an elbow bump before their photo. It is now a true honor that we recognize our doctoral graduates from the class of 2024. We will begin with hooding our Doctor of Public Health graduates who are on their way around. I see them on their way. We also need the mentors to come forward. It's a real honor to call these names. Dr. Karen Shapiro is being hooded by Dr. Laura Lindberg. Dr. Rebecca Ofron is being hooded by me. I'll be right back. We will now hood our Doctor of Philosophy graduates. Will the PhD graduates of the class of 2024 please come forward? They're there. Dr. Grace Ibatamuna is being hooded by Dr. Alan Monheit. Harder than it looks. Dr. John Palatucci is being hooded, also by Dr. Alan Monheit. Dr. Harrison Nasir is being hooded by Dr. Nir Ayal. Dr. Namit Shah is being hooded by Dr. Judith Graber. We will now recognize our 2024 post-baccalaureate certificate graduates. Will those graduates please come forward? And our first graduate with that degree is Alejandro Ruiz. We will now recognize our 2024 Master of Science in Biostatistics degree graduates. And our first graduate is coming forward. Thank you. Marisha Shantakumar. Rafa Salis. Jasuni Jawarenda. Tianyu Fu. Irvin Pastor. Harrison Clement. We will now recognize our 2024 Master of Science in Epidemiology degree recipients. Thank you. Sharmitha Saha. Thank you. Shramona Sarkar. We now recognize our 2024 Master of Science in Epidemiology, I did this so many times because this is the Chancellor's degree. I have to do this correctly. Master of Science in Epidemiology, Pharmacoepidemiology degree. Please come forward. Priyanka Yalamanchili. Sneha Goitonde. Sarah Chu. Yuyang Zhu. Kahinde Adeyemi. We now recognize our 2024 Master of Science in Health Outcomes, Policy, and Economics degree graduates. Will those graduates please come forward? Sumi Kakehi. Mohin Chanpura. It is now my pleasure to welcome Dr. Kristen Krause to read the names of our Master of Public Health graduates.
Hi. Hi. Thank you. We now recognize our 2024 Master of Public Health degree graduates. We are proud to recognize several inaugural graduates who are part of our Master of Public Health and Population Aging degree, Master of Public Health and Population Mental Health degree, Master of Public Health and Public Health Practice for Health Professionals degree, and Master of Public Health and Online Global Public Health degree. Will the graduates of the class of 2024 who are receiving their Master of Public Health degree please come forward to be recognized? when a staff member asks you, oh, look, you're here, to rise. The external color of the Master of Public Health hood is salmon pink. This is the official color for public health and denotes the profession. And we did not get a choice. It stuck with us. Nikesha Gonzalez. Elizabeth Placoy. Loretta Amaning. Amina Masami. Catherine Miller. Megan Bissett. Emily Thampo. Anna Busler. Sophie Wilkinson. Pratusha Bunaman. Samuel Goche. Gabrielle Bromfeld. Kisariri Evans. Ifoma Onyuku. Ruth Molineth. Jacqueline Mwakanamale. Suhaila Still. Suhaila Still, sorry. Sophie Narula. Victoria Pashinska. Jennifer Green. Tenzin Sangmo. Nancy Salem. Mercy Baden. Enyonam Fiakbo. Olusola Ola Tubosin. Olutosin Ola Depo. Rashika Balian. Janvini Ganesh. Harini Patabendi. Puneet Sangha. Aldrich Crispino. Alexander Gowachuk. Stephen Kahn. Elizabeth Hernandez. Alexa Fumarelli. Sean Farrell. Eric Schwartzman. Brenda Josephine Ansong Abavan. Jacoby McLean. Catherine Hewitt. Stacy Gusak. Ivy Davis. Nicole Shen. Amber Ewell. Caroline Afonso. Ifra Bajua. Tashmim Begum. Lamia Rashid. Masuma Musavdi. Hudris Zueju Meng. Alexandra Wedragu. Salamita Guim Fall. Bill George. Amber Folnagi. Kayla Deno. Aya Abdenan, oh, I'm so sorry. Aya Abdekalnek. Vanessa Varkey. Gio Chanchard. Prachi Trivadi. Nyander Gandhi. Garima Mittal. Brittany Carlozi. Abigail Baffa. Anushka Chatterjee. Jocelyn Jaramillo. Aaliyah Pe Benito. Morgan Durant. Justin Najimian. Joseph Lepore. Shannon Risbrook. Daphne Sawyer. Mikasa Modi. Lu Mi-ai. Eric and Keeve. Caroline Morales. Nisrag Patel. DG Johnson. Manju Ajanatri. Kirti Sharma. Vrishti Talangokar. Alimatu De Alo. Ani Ponasian. Christine Dempsey. Eugene Jiang. Sukriti Kaul. Janelle Ball. Lu Ming Gao. Narish Etla. John Berezniak. Nabil Mamor. Eric Wuthrich. Christopher Roberts. Nikesh Mohandas. Amisha Manhas. David Carmana Avila. Corey Rem. Kwaima Wright. Travis Love. Catherine Tweet. Ariel Lonoff. Catherine Wingert. Megan Luo. Jocelyn Dackwell. Sophia Bonsanor. Harrison Joseph. Melanie LaVake. Caitlin Oriarte. Stephanie Verdugo Hernandez. Orion Sun. I don't know you. She don't know her. Kendra Lewis. Sophia Vallejo. Maria Weck. Michelle Sanchez. Hangxing Liu. Josephine Awadala. Carolyn Waddy. Ayla Altunbalek. Krishi Bombat. Irum Iqbal. I don't know you either. Cynthia Lockwood. Victoria Oderson. Ian Joshua Orianis. You can do your own thing. Christina Krakowski. Marina Garcia. Oni Najamfor. Rihem Abdin. Erica Achempoma. Danielle Barchi. Archandi Hignes Mev Anyo Minilo. Robert Hennifer. Congratulations to all of the graduates, their families and friends, loved ones and guests. Dean Halkitis will now close the ceremony.
Yeah, congratulations. All right. I want one more time, graduates, a round of applause for your family, friends, and loved ones who saw you through this. And let's do one more for your teachers who saw you through this process. And to me, no. In closing, we express our appreciation to Rutgers Health, the Rutgers University Governing Board, and the university as a whole. I want to express my appreciation to the staff and students who made this convocation a special event for all of us. I love how loud and boisterous you were this year. It speaks to my soul. Graduates, spend time today with your loved ones. Thank you for being with us. We hope that you can join. Does anybody know if it's raining outside? Nobody knows? Okay. We're going to assume it's not raining. Thank you for being with us, and we hope you join us outside for a reception celebrating your achievements, which is taking place on Livingston Lawn that is visible from the arena. Graduates, please make your way to the front stairs after the faculty recessional. Family and guests, make your way up to meet the graduates outside. Please use the side exits. One more time, a round of applause, 2024. Dr. Merchant, where are you? Dr. Merchant will lead us out. Let's go, Dr. Merchant, we're ready to go.